Baik, saya tes dulu suaranya apakah saya sampai atau tidak. Baik, Bapak Ibu sekalian dan hadirin, as we are about to begin, we would like to remind you that this meeting is being recorded, so please remember to mute your phone or computer when you are not speaking. Bapak Ibu dan hadirin sekalian, acara akan segera dimulai. Dimohon untuk tidak mengaktifkan dering telepon ataupun komputer, atau silakan mengubah ke mode getar atau diam. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Have a very
Waalaikumsalam.
good morning to all of us.
Waalaikumsalam warahmatullahi wabarakatuh.
We are delighted to warmly welcome you to the International Guest Lecture, which is held today by the Department of Nutrition and Health of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. My name is Umi Salama, and I am honored to be your Master of Ceremony who will guide you through our program today. It is an honor to us to welcome distinguished Head and Secretary of the Bachelor in Nutrition and Health, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, distinguished lecturers from the Department of Nutrition and Health of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, honorable speakers, Prof. Zahara Abdul Manaf, and also Dr. Nurul Huda Razalli, Master of Science RDN from Dietetics Program, the Faculty of Health Sciences, University Kebangsaan Malaysia, and also we welcome all students, clinical instructors, and participants of the event. First of all, please introduce you to the agenda of the event today. In the opening session, there will be a welcome speech from the head of Bachelor of Nutrition and Health, the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. And then it will be followed by presentations of our guest lecturers, Prof. Zahara Abdul Manaf and also Dr. Nurul Huda Razalli. And then the program will be followed by discussion session. And finally, these whole programs will be summed up by photo session. Bapak sekalian, ladies and gentlemen, para hadirin, to officially open or start this program, may we kindly invite the head of the Bachelor of Nutrition and Health of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada to give a welcome speech. To Ibu Erdwi Budisari, please.
Yeah, thank you very much. Yeah, thank you very much, Mbak Umi. Yeah, Assalamualaikum warahmatullahi wabarakatuh. Very good morning for our distinguished guest speakers, Associate Professor Dr. Zahara Abdul Manaf and Dr. Nurul Huda Razalli from Dietetics Program, Faculty of Health Sciences, University Kebangsaan Malaysia. Good morning to our undergraduate students, academicians, practitioners, also other nutrition enthusiasts. On behalf of the Head of Department of Health Nutrition, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, allow me to express great pleasure to extend to you all a very warm welcome and to say how grateful we are to our honorable international guest speakers who have accepted our invitation to share their expertise and experience in this virtual international guest lecture in Food and Nutrition Data Management course on the topic the role of the big data and digitalizations for promoting nutrition and health. Nowadays, the use of digital technology has grown very rapidly. This technology can assist to health, nutrition, as well as promoting nutrition and health. Digital literacy is one of the skills that must be mastered by healthcare staff, including in the field of nutrition. However, research suggests that many healthcare staff don't feel adequately prepared for using new healthcare technologies in practice. Therefore, nutrition students should be introduced and taught digital literacy, including big data, so that they can be more prepared to use and manage new technology for promoting nutrition and health. one of the elective courses in the Bachelor of Nutrition Study program, Faculty of Medicine, Public Health and Nursing, Universitas Mada, Indonesia is Food and Nutrition Data Management. So for all of us as an academician, students, nutritionists, and also practitioners in the nutrition field, it is necessary to broaden the current information and latest scientific knowledge of the role of big data and digitalization for promoting nutrition and health. We are very much thankful and appreciation to our guest speakers and also moderator Bapak Anis Fuad and all of participants. And in concluding, I wish you a fruitful guest lecture. Thank you very much.
Thank you so much, Ibu Nuning, the wonderful remark. We shall proceed this event with the presentation by the guest lecturers. We are privileged to have Professor Zahara Abdul Manaf and also Dr. Nurul Huda Razalli, Master of Science RDN from Dietetics Program, Faculty of Health Sciences, University Kebangsaan Malaysia. This session will be guided by Bapak Anis Fuad, SCAD DEA. Bapak Anis Fuad is now the lecturer at the Department of Biostatistics, Epidemiology and Population Health, the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. Bapak Anis, the floor is yours.
Thank you, Ibu Mi. Good morning, all participants in this international lectures, especially our distinguished guest speaker from University of Kebangsaan, Malaysia. Good morning, selamat pagi, Prof. Zahara and Dr. Nurul Huda. Thank you for thank you for coming to this session and also give and share your insight and also experience to our student in Gadjah Mada University. Before we begin, may I know whether we will have a panel so that the discussion will be later together, or we start one by one lecture and then discussion?
One by one. Yes, we'll start with Prof. Zahara, please. One by one.
Prof. Zahara?
Yes.
Prof. Zahara, and then discussion, and later with Dr. Nurul Huda and also discussion.
Yes.
Okay, yes, okay. Yes, thank you for your confirmation. So we will start with our first session with Professor Zahara. Associate Professor Dr. Zahara Abdul Manaf will present her lecture with the title on how digital technology can assist health nutrition education and promoting nutrition and health. And before we begin, just a little bit the biodata of Professor Zahara Abdul Manaf. She's lecturer and dietitian in the Dietetics program at the Faculty of Health Sciences, University of Kebangsaan, Malaysia. She holds a bachelor and master degree from UKM and additionally hold a Doctor of Philosophy degree from the University of Newcastle upon Tyne, United Kingdom. With over 27 years experiences in the field and more than 100 articles in the journal and 8 books, I think we are very happy to have Professor Zahara to give her insightful speech in this session. So please welcome Prof. Zahara, and how about the 30 minutes for presentation and then discussion?
Yes. I'll try.
Okay, and then yes, okay, and then time is yours.
Terima kasih Dr. Anis, also Dr. Dewi Butisari, and Mbak Umi Salama. Thank you for the invitation. Can I have a voice check, volume check, whether you can voice clearly?
Yes.
Okay.
Awesome.
Thank you. Thank you for the invitation. I hope everyone is
okay and healthy this morning. So I'm going to share. I received pop-up notification that my internet is not stable now. So I turn off my video while sharing my slide. Can you see my slide?
Yes.
Yes, clearly.
All right. Okay. All right. So for the first part, I'm going to focus on the how digital technology assists in promoting nutrition and health. And the second part, Dr. Nurul Huda will focus on big data and how it is related to nutrition promotion. So for the past few years, we conducted a few studies to explore the potential use of digital technology in nutrition care, particularly among dietitians in Malaysia. These are a few publications, and we have a few more on in the pipeline. So first we explore the quality of the mobile apps, focusing on non-communicable disease, and you can check this article online or free access, and the perception of a dietitian on the digital nutrition education tools in Malaysia. So in this 30 minutes, I'm going to focus on understanding digital technology in nutrition and what are the common digital tools available in the market that and some of the tools that we are using. Perhaps I think Malaysia and Indonesia, we have not much difference in terms of the tools that we use in nutrition education, and a bit of reflection on challenges and opportunities in digital technology in nutrition education, and the future of digital technology that we can explore. So digital technology in nutrition covers electronic tools, devices, resources, for example, mobile apps, wearables, e-learning platform, AI, and telehealth. I think most of you are very familiar with apps. And if you notice, if I'm looking at my mobile phone, I have few apps that I install to monitor my diet intake, to monitor my physical activity, but I rarely use them. I only use them for the first time I install, then after that it just, you know, new apps install, then I use once. So because the number of apps in the market now is increasing, and it become more advanced. So if you ask your patient to manually record their food intake, you may have hard time to get their cooperation. But if you ask them to record their intake digitally, perhaps you can get better cooperation. Now, because people don't want to, you know, enter it manually, type, use the keyboard, they just want to scan QR code. Just now you scan QR code to record your attendance, right? So for recording food intake, also people prefer scan. And food intake, you just snap photo, and the mobile apps can analyze the nutrient content. That's the current trend. So why is it important, digital technology in nutrition education? Because it improves health literacy. It is more convenient and accessibility. If you traditionally we see patient, we educate the community, we deliver through face-to-face seminar, but now you can reach out many people at one time if you use for example, now we can communicate through Zoom platform, so we can overcome the barriers, logistic barriers, and in real time. So it is the same when you want to access your client or patient, so you can communicate with all your clients in Indonesia or other parts of the world at the same time. And it enhances engagement because you can use other digital tools, digital education tools at the same time when you communicate with them. And digital technology also allows personalization, which I'm going to explain more in my next slide. So in this slide, you can see various categories of digital tools in nutrition care process. I think you are familiar with steps, 4 steps of nutrition care process. You can see how digital tools play roles in these 4 steps, from nutrition assessment, nutrition monitoring, evaluation, intervention, and diagnosis. Okay, so you can see wearable devices can be used to monitor, mainly to monitor intake, physical activity, and other clinical indicators. mHealth and eHealth for intervention, and a big data analysis mainly for nutrition diagnosis. Okay. And the social media also covers, it is part of the digital tools that can be used in nutrition education, and telehealth. So I'm going to talk more on telehealth in this presentation. So if we look at the application of digital application in nutrition, first we may be introduced by food intake tracking apps, which allow user to log whether manually or use barcode or snap their food intake, and analyze nutrient values and track progress toward their goals. For example, I'm sure you are familiar with MyFitnessPal, Fitbit, and so many other mobile apps to monitor mainly food intake, which you can get nutrient analysis and how far from your target goal. When you install the apps, they will ask you your age, gender, and whether you want to your target in terms of body weight and other health indicators. So they will try to come up with, the apps will come up with a suggestion in terms of the calorie, and you can monitor your intake and your weight. Okay, and also apps that can deliver personalized advice, which you can communicate with dietitian or nutritionist through the apps. So it is a corporate can be comprehensive wellness program with coaches. So I think you may be familiar with Healthify Me, which you can select fitness coaches, dietitians. So wearable technology, the common tools is smartwatches, fitness trackers that can provide insight into individual nutritional intake, activity level, and you can monitor calorie in, calorie out at the same time. And a wearable device can be connected with your mobile phone. And some of the website, they can provide meal planning platform. For example, my NutriCard here, which you can check out after this. That can generate a personalized grocery list based on the calorie and nutrient requirement, and promoting health for healthy food choices. Okay, telehealth. Telenutrition is a visual platform to facilitate remote consultation with dietitians, enabling personalized guidance and support. I'm sure in Indonesia and Malaysia, I think during COVID-19 MCO, which we cannot see patient face to face, we use telenutrition more. Most of us use telenutrition to reach our patient. So telenutrition allows dietitian nutritionists to provide nutrition counseling using telecommunication. We can use video conferencing, email, text messages, combine all these or one of these platform. So activities usually deliver nutritional assessment, provide menus for the patient, analysis and management plans, and follow up with patient or client. So the most significant advantage of telenutrition is we can access to remote communities. So you don't have to physically go in the remote community to see your patient. Okay, in this slide, you can see photos, dietitian promoting their nutrition services. You can see different topics she's promoting. In fact, she promote guidance how to read sugars, to understand the terms used in the food labeling. Just focusing on this topic, and she used a Google Meet platform. And those who want to join, perhaps first few session, she provide free without any fees. But after, when so many people know about her service, her expertise and followers, she usually charge. Okay, that's what normally people do when they provide service. So and you don't have to have physical premise or office to start your service. You can use digital platform. Okay. And here, one of the photo in the middle is dietitian for nutritionist is giving guidance to her clients how to take waist circumference measurement from distance. Okay, and the last photo is the WhatsApp video teleconferencing between dietitian or nutritionist and patient. In terms of the effectiveness, maybe perhaps one of you have read this article, systematic review about the effectiveness of, for example, weight management intervention via telehealth by dietitian. The review found that exclusively in person, meaning giving dietary advice face-to-face, one by one, is equally effective with combination of in-person and remote. And these two methods is more effective than exclusively remote dietary consultation. So meaning if you want to choose which method is effective to deliver dietary advice, either face-to-face, one-to-one, or combination. Maybe first visit or first two visit, you see patient face-to-face, and for the follow-up, perhaps you see your patient through telenutrition, either Google Meet or WhatsApp video call, okay? And exclusively remote is least effective because it is not easy to monitor their progress, and engagement is usually less. I will cover more about that, the challenges of the online services. These are some of the barriers to provide telenutrition service. And I think this is very common. It is also applicable in Indonesia as well. And it is definitely applicable, these findings applicable among dietitians in Malaysia, which we found the same result. The first one is not being able to conduct or evaluate some of the typical assessment or monitoring or evaluation activities. For example, they said they cannot take weight, height measurement, especially if the patient, they don't have the weighing skill, and if you base on their report, and you ask them what is your body weight today, so perhaps they don't have the weighing scale, or they just say whatever they want to say, so perhaps it is not the actual weight, for example. And perhaps the patient may not have equipment to deliver. A dietitian may not have sufficient equipment to deliver telenutrition, which is also relevant to our dietitian in Malaysia. In the clinic, they don't have a designated area to deliver online consultation. Sometimes they have to use their own handphone and so on. And perhaps client may not have telephone, landline or mobile line, or they don't have smartphone, or they are not familiar with a digital platform that the dietitian or nutritionist use to communicate with them. And access to the internet is quite challenging, especially in the remote area. And client may not interested in receiving telenutrition. Some of the patients prefer to see nutritionist or dietitian face-to-face, and lack of employer support to deliver telenutrition, and discomfort in delivering nutrition care through telehealth. These are the benefits of delivering telenutrition. You can provide real-time access to reliable nutrition information and improve patient access, which I mentioned just now. You can access your patient without any logistic barriers, and flexibility in terms of the schedule, save travel time. Some of the patients, they have to pay for the parking and have to travel along the way to see the nutritionist or dietitian, especially patients who live in the remote area. And you can reach a greater number of patients, especially in a public emergencies such as during COVID-19. And you can give a nutrition counseling in patient kitchen, provide a window into their cooking and storage space, and allow the counselor or nutritionist to review labels and food product. You can ask the patient to, to show what are the food in their fridge or their kitchen cabinet, and ask them to show what is the brand. Sometimes in outpatient, when you see them in the clinic, you get on their memory. Okay, the brands, the name of the product, the ingredient, but do online, because you can ask them to show what the product, so you can get information more accurately. We can also get access to interactive learning apps in the Play Store and other platform. For example, nutrition and health information quizzes, which the public anybody can install and get the information easily about they don't have to read newspaper or magazine, but they can get all this information through the mobile apps. But if you notice, as the professional in nutrition and dietetics, we can evaluate some of the information are not reliable. And this is one of the comments that we get from nutritionists and dietitian. Information in the mobile apps, any people with any background, they can create apps and put information about nutrition and dietetics, and this information access to the public. So this is one of the limitation of the information available in the apps. Okay, so it is very convenient. If you want to use these tools to educate your clients, you can choose the most reliable apps. Once you know your area, you know which apps it is reliable and in terms of the information, and you can use in your education program. Next is gamification and stimulation. It is very popular, amazingly popular. It is innovative features in diet gamification apps. The features usually consist of reward system, use of AR, for example, grocery shopping. So when you wear the tools, so you can get, you can have as if you are in the grocery store, but you are in the room. Okay, and can get access to virtual diet coach, social challenges. Perhaps you can have other patient in the grocery when they are in the same game, and the real-time feedback, and you can choose personalized avatar. Okay, so in one of the picture, this picture shows VR for the food preparation training. So you just, because the young generation nowadays, many of them don't know how to prepare food. So using this technology, it can help them to prepare, for example, healthy food, and give them more confidence and motivation. And in the grocery store, we can guide them how to choose healthy food, how to read labels and understand food labels. I think all of us are using this technology, infographic and short videos. Within minutes, you can prepare nice pamphlets, nice posters, and interesting videos. And it is all fingertips, and we can use our mobile apps. So maybe 15 years ago, 20 years ago, it take days for us to prepare all this education material. So we can create a balanced plate, infographic and videos. In Malaysia, we call suku-suku separuh. So in less than 5 minutes, you can prepare a very interesting. All this now, because when we want to educate, give a nutrition education to the public, it is all visual and interaction. So we have to know how to use all these tools to enhance the quality and the information that we want to deliver to attract attention. And social media for nutrition promotion. I think most of us use this social media, Instagram, TikTok. For example, we want to do campaign suku-suku separuh quarter half, the healthy food model in Malaysia quarter half. Okay, and it can engage the public. Traditionally, we use newspapers, we use magazine, we use website, but now we move to social media, and we can reach many people at one time, and without very little cost or no cost at all. And we can influence the audience by using different different methods, you know, with infographic, games, quiz, and perhaps you want to get nutritionist or dietitian to talk in the social media, or you want to get influencer involved in the in promotion. So at the moment in Malaysia, we have a manual. There's a guide for virtual consultation produced by Ministry of Health. This is used by most health professionals, including doctors, pharmacies, dietitians. So it is a guidance. For example, before you want to see patient, what you have to do, during see patient, what you have to do, and after that. So it is a guidance for us to use. Okay. This is a website that the public can get access to a dietitian. It is a grocery store, actually. Grocery store, which you can set appointment with the dietitian, and the dietitian will guide the client in terms of dietary plan, and then ingredient to buy, and then the menu. Okay, so now this not only go and buy grocery, the food ingredient, but the grocery store also provide dietitian service. This is online nutrition counseling in Malaysia by top dietitian, and some of these website they also provide nutrition consultation by nutritionists as well. So it is easy to get nutrition and dietetic consultation all in the fingertips. You don't have to travel all the way to see them. This is Diet Ideas. The founder is our alumni. She provide virtual consultation, also health screening, whereby their team can go to the patient's house and then do the blood test. And then they also have fitness coach. They also provide healthy diet to their patient, which the cooked food can be delivered to their house. So these are a few of the websites that are offering nutrition and dietetic teleconsultation. Okay, some of these are our alumni. Okay. We noticed that the young generation, they don't want to go to the clinic physically to see a dietitian or nutritionist. They prefer online consultation. So the benefit of digital technology in nutrition education is we can reach wide range of people and real-time feedback. It is less costly, and it can be cost-effective if you design it well planned and if you target the right client. For example, your client is elderly, poor IT or literacy. Perhaps online consultation is not the best for the patient. Perhaps you have to engage the family members, or you want to see them face to face. In terms of challenges and limitation, it can be misinformation can happen during the consultation, or when you send them posters, flyers to WhatsApp and all that, because you are not there to explain. And privacy concern, this is one of the main concern by our dietitian as well as our patient, because they said your client can record the session and viral and use it to against them. Viral in the social media, it can happen, and they can modify, you know, the recorded session and then use to promote products. So this is one of the concern. So in the guideline that produced by the Ministry of Health, we have to inform the client before the session that they cannot record the session. Okay, but the risk is still there because who knows, the clients can record it because we are not there with them to observe. And perhaps the challenges is the digital literacy in a certain segment of our patient, and accessibility, as I said, the internet accessibility, especially in the remote area or in the socioeconomic challenge segment in our society, which perhaps they don't have appropriate gadget for us to communicate with them digitally. And in terms of ethic and responsible use, we have to use evidence-based content, even though we use social media or gadget to deliver our nutrition education. And we have to respect both ways. Client and health providers have to respect in terms of privacies. These are the potential future application of AI in clinical nutrition. First is precision or personalized nutrition, which use AI algorithm to identify specific nutrient that an individual needs based on their genetics, microbiome, and etc., to provide personalized nutrition recommendation. So I think nowadays precision nutrition is trending, but we need big data. The bigger the data that we have, so that the technology can learn from the data, the more precise the personalized and personalized nutrition recommendation we can deliver to our client. Okay, so for example, ChatGPT is AI tools that can learn from information that they can gather from the internet and information that you input. I noticed yesterday, ChatGPT come up with information. When I click the reference, they use my articles to give you information. So they are very these AI tools is very efficient in extracting information, because my article is free access, so ChatGPT can get access very quickly. And then predictive analysis, use AI models to predict patients' risk of developing certain nutrition-related condition. For example, AI can predict obesity or diabetes, and you can provide recommendation for prevention in advance. You don't have to wait until the health problem occur to give recommendation. But all these applications need big data. Okay, so at the moment, these are the limitations. So if you look at the prediction and personalized nutrition, sometimes it is not really accurate because of the data limitation in the food database, and then perhaps the health information about your client. Next is virtual coaching, using AI-powered virtual assistant to provide ongoing coaching and support patients to improve their nutrition and lifestyle. So perhaps this virtual coaching minimize the number of dietitian required in the hospital, because I think most hospitals, especially in Malaysia, we are having problem in terms of lacking of number of dietitian as compared to the number of patients in the hospital or in the community. So visual coaching can perhaps help us in the future. And autonomous meal planning using AI algorithm. I think many researchers are doing this research area. It can be used to automatically generate personalized meal plan based on individuals' preference, dietary restriction, and health goals. When you enter age, gender, and food preference and all that, so you can share the meal plan to your client in few minutes, for example. Okay. So for student, what you should do, just stay up to date in terms of what are the digital tools that available can be used for nutrition promotion and application, and use these tools appropriately, and create responsible content. So if you're a student, perhaps you need to check with your supervisor, your lecturer, to ensure that your content is correct before you post it or share with the public. So as a self-reflection, perhaps you want to think what are the nutrition technology that you use at the moment and why you use it, what are the advantages and disadvantages. I think we don't have time to discuss about this. You can discuss among yourself after this. Okay. Thank you. Pass back to you, Dr. Anis.
Yes, okay. Thank you very much, Prof. Zahara. A very insightful lectures. And student, I think we learned a lot from the presentation of Dr. Zahara. Not only from her research, that it is also interesting that ChatGPT also finally knows that you have already certain research that has been used by ChatGPT to refer for any people consulting to ChatGPT. That's also among the most interesting one with the growing trend of AI. We have 5 minutes for question and answer with students. Any comment, sharing, or question from students to Prof. Zahara? Or from colleague? Uh, if not, I have one question from Prof. Zahara. I think later students or also other could also have another question. My question is related to the current trend of many apps in nutrition. You have also one interesting paper that I read related to the mobile application rate scaling. Based on your research, what are the most important aspect of mobile apps in Malaysia related to the nutrition that are considered beneficial or useful for the users or based on your research? Currently, for example, I saw many advertisement right now. Many application right now are being used to 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 get the picture of our menu and then keep inside how many carbo, how many protein in our menu. Any insight related to your research on that part?
Thank you, Dr. Anis. I think most of us are researchers. We have time to get our research response study to
Yeah,
record their food intake, right?
yeah.
So usually we give digital questionnaire or printed questionnaire for them or food diary to record their food intake, but the information we get most of the time are incomplete because they are used to
Okay.
apps, used to digital, fill up everything digitally. So
Yeah.
before this, we have apps that we can scroll what the food that we are eating, manually scroll.
Mm,
But now
yeah.
we cannot get cooperation as well, that version.
Yeah. Mm,
So the most preferred apps is scan the food,
yeah.
scan
Mm,
photo, and then all the
mm,
nutrition information will come out automatically. That's the most
yeah.
preferred apps.
Yeah.
But again, we have limitation because the type of the food, the menu is keep increasing, keep changing the way we cook food.
Yeah.
And in Malaysia, the most common menu is nasi lemak. So the
Yes. Yes.
nasi lemak 5 years ago and now it's different. So we have to make sure that the apps have the nutrient information that they provide to the user is correct. So that is the most challenging
Yeah.
part if people use apps to make sure that the app is clever enough to give
Yes.
accurate information. They can use any apps in the market, but which one is the most accurate one? So from our study,
Mm,
when we review apps in the market, there's most of the time the app is designed for IT or anyone without any nutrition or background. Or in their team, there's no nutritionist or dietitian when they develop the apps. Imagine
okay.
who can
Okay.
validate their apps, whether it is useful or can down, and the more convenient the apps, that's the most preferred one. But whether they provide to information, that's remain I think the gaps that we as a professional in this area need to come out perhaps apps that contain big data of information related to food, for example, in Indonesia, or the food item Indonesia in the apps. So when the user use it, the nutrition information as output is complete. So because the trend is very fast, so we need to keep update very fast.
Yeah. So is it also your call for our nutritional students so that we recommend them to join for any innovation, to develop, to evaluate, and also to join with other students, for example, from the informatics program, to innovate for any apps related to the nutrition, given that you mentioned the menu, the innovation always changing.
Yeah. So when they want to do FYP, thesis or master or PhD project, they can always collaborate with their friends in IT faculty, so they can come up with innovation that is more relevant to the market needs.
Okay. Thank you, Prof. Zahara. Any other comment or question? If not, I think we conclude the first session from Prof. Zahara Abdul Manaf. Thank you very much for your insightful speech. We learned a lot with the new technologies, and we hope it will inspire our students to learn more, to stay updated, and then to promote for further collaboration with other students to develop new innovation in digital technology for nutrition. And I think also for the forthcoming or the future nutrition students, given that the digital technology is also growing fast, we hope also they need to develop the skills and knowledge because their future career should also be need tech nutrition that fulfill the needs for the futures.
I'm sure they learn faster than my generation.
Yes, our generation, Prof. Okay. I agree with you. Okay, thank you very much. Thank you very much. Yeah. Thank you very much, Prof. Zahara.
Because they were born in the IT era. They were born in IT era.
Yes.
So it's easier for them.
Yes. Yeah. But we learn a lot from you, from our generation, because many paper related to these new technologies, or the implementation of technologies in nutrition are coming from us. Okay, thank you very much, Prof. Zahara. And then we can continue with the next speaker. Give applause to Prof. Zahara, and thank you very much. And then we uh, we continue with the next speaker. We invite Dr. Nurul Huda Razalli. Good morning, Dr. Nurul Huda.
Morning.
Salam from Yogyakarta and Gadjah Mada. Thank you very much for coming to this session in front of our students. So, Prof. Nurul Huda is lecturer from UKM as well. She will be speaking, I think, related to something behind this AI and also new technologies is the big data. So she will be speaking about the big data concept and AI in nutrition through real case examples. So Prof. Nurul Huda with a PhD and also registered dietitian in Malaysia with many publication is a very appropriate uh, speaker to speak on this topic. So without further ado, we give a time to Dr. Nurul Huda. Please, Dr. Nurul Huda.
Thank you very much, Dr. Anis, for That was a very kind introduction. um, Thank you to everyone. Assalamualaikum warahmatullahi wabarakatuh. Very good morning. It's my pleasure to again be here after a year. Thank you very much, Associate Professor Dr. Zahara, for her talk about digitalization and its usefulness in nutrition. The topic that I was given is about big data. Well, I'm pretty sure most of us, we feel quite comfortable, right, when we uh, heard about digitalization. But um, when we talk about big data, somehow we're like, well, I've heard about big data. I'm not really sure about big data. So when Dr. Anis was saying that I'm like uh, the right person to talk about this, well, I would like to defer that. This is something I believe it's pretty new for us. So I have prepared some slides. I'll try to keep it short and simple so that we have more time to discuss more on this. Let's learn together. I would say that rather. Let's learn about this together, about big data and its role in nutrition and health promotion. Okay, in this lecture, I would like to hopefully cover all this. First and foremost, of course, what is big data actually? Where does big data come from? Particularly when we are talking about nutrition, in the field of nutrition. Why is big data important for nutrition and health? The benefits of using big data. And of course, we will also cover what are the challenges of big data, especially in the area of nutrition and public health. Okay, so let's start. What is big data? As what I mentioned earlier, all of us, we might have heard about big data in this couple of years. It's been talking about pretty much everywhere. Big, of course, when we see the word big, it means large, it means huge, and data is mainly information. So when we heard about the word big data, we know it is talking about large, huge information. Okay. Everyone has smartphone nowadays. Okay, you have smartphone, I have smartphone, and we use our smartphone. We have a lot of applications in our smartphone that we use every day. Okay, so just imagine like in your class, each and everyone has smartphone. In a country, or even like in this whole world, there are so many smartphone users. Okay, and these are some of the common applications that we use that can contribute to big data. So let's have a look at the data generated per minute. Like on Snapchat, there are like 2.1 million data. There are 3.8 million Google searches. Like nowadays, we Google everything, right? We ask ChatGPT. We use Facebook a lot. We use YouTube for entertainment, text messages. That's a lot of data. So this large amount of data is really a lot for traditional computing system to handle. What does it mean by traditional computing system? Like in your computer, in your laptop, we store files. We store information in files. But for big data, this is too much. So that's why we call it big data. Okay. By definition, okay, when we are talking about definition, big data means a huge amount of information collected from many places. Just imagine like how many smartphone users, and we are all over the world, right? And the information is very quick and in many different forms. As I said, there are so many apps, there in terms of entertainment, like videos. We have text messages. Okay, so what are the characteristics of big data? this is the least characteristic of big data. If you search more, some will say like the 5 Vs, the 6 Vs, okay? But these are the minimal characteristic of big data. Okay, the 3 Vs. One is volume. When we're talking about big data, it means it involves a large amount of data. Velocity. Data comes in fast. In 1 minute, there are so many people updating their Facebook status, updating their WhatsApp status, posting, have posting on TikTok. Okay. And the last V is variety. Data comes from many sources. It can come from applications, social media, surveys, etc. Okay. Where does big data come from? Mainly when we are talking about big data, we are talking about digital form. It doesn't mean that big data cannot come from manual form. But in this era, when we are talking about big data, we are actually focusing more on digital data, digital form. It can come from social media, smart devices like the wearables, right? We wear watch and all. Online transaction. Okay, most of us, we are more comfortable doing online transaction like banking transaction and all, or even electronic health records. Electronic health records, even in Malaysia, even though we do have hospitals who have started to use electronic health records, including our own teaching hospital, UKM Teaching Hospital, we have pretty much fully all our wards have been using electronic health records. So that can also be one of the sources of big data. When we are focusing or zooming into nutrition, where can big data come from in the field of nutrition? It can come from mobile apps. Some of the apps that have been covered by Dr. Zahara in her talk. There are a lot of even free mobile application where you can track your intake, food intake, your fitness level, your health. Okay, this can also come from online survey and government databases. I'm pretty sure in Indonesia, you also have like National Health Survey, something like that. Okay, even in Malaysia, we do have our National Health Survey, we call NHMS. Okay, where we have both right now. You can when they do the data collection, they do both online and also still they do manually. Okay, to reach those Malaysians who might not have access to do the online survey. Wearable device like smartwatches, as what I've mentioned previously. Social media, your posts, your photos, hashtags, okay, even hashtags, these are all data. Okay, health records from clinics or hospital. Okay, this I'm just trying to putting in some examples so that maybe we can better relate. This one I Google. Okay, I Google. So big data. I mean, this can be one possible data if a mother enters a baby weight into the Posyandu app. So I Google, and it looks like that the Faculty of Medicine of Universitas Pajajaran, they are actually currently building in this app. Okay, iPosyandu. Okay, so I guess this is a really useful app. So later on, maybe we can discuss something about this. But this is something that is useful. So when you have information being recorded in digital form, we can use this data better. Okay, of course, we have data, a lot of data in manual form, but because it is in manual form, when we want to analyze manual data, it can be, it will take a lot of effort. Okay, but when we have like digital version, then the data that we have can be analyzed better. So that one is an example from Indonesia. Maybe later on, if you have any more insights on what other applications related to nutrition and public health that are available in Indonesia, we can also discuss about that. In Malaysia, we have this app called My Sejahtera app. Initially, this My Sejahtera app was used during COVID time. Okay, during COVID time, to basically track the whereabouts of not just Malaysians but anyone in Malaysia. So basically, in My Sejahtera app, when you want to enter any place, so if you go to the supermarket, to any shop, to hospital, anywhere, even on campus, even like if you are in the building, each room will have to generate their QR code. Okay, they have to generate the My Sejahtera QR code. So if you want to enter, and they make it compulsory, if you want to enter the supermarket, hospital and all, you have to have your My Sejahtera app on your phone, and you have to scan this QR code so that they will track where is your whereabout. Okay, so for example, if COVID is being spread in that area, they know who were the people who came to that place. So that was the initial use of My Sejahtera app. Okay, so that's why I put that dalam kenangan, rest in peace. So in May 2022, the use of My Sejahtera app to like in May 2022, the Malaysian government has stopped the use of My Sejahtera app for us to scan. Okay, when we want to enter to any places, we have to scan. So basically, after May 2022, we don't use My Sejahtera app anymore to scan for us to enter to any places. But now, what happened to My Sejahtera app? They upgrade because pretty much many Malaysians have this My Sejahtera app. Because during COVID, like if you want to enter any places, you want to go find entertainment, go to a park or something, you have to have My Sejahtera app. So pretty much many people in Malaysia have this My Sejahtera app. So they use this opportunity to upgrade My Sejahtera app to be a digital health record. So I have here my own screenshot of my Sejahtera app. Okay, so they have include many more functions. If you can see here, they have like organ donor pledge. If you want to be an organ donor, you can just click on that. Okay, infectious disease tracker, appointments. Okay, My Minda. This is for mental health. Okay, or you can even locate health facilities. Okay, so previously My Sejahtera was just used for COVID. So even when you are COVID positive, you need to update in the app that I'm COVID positive. My dependent, my children, my spouse also being COVID positive, and they track your how many days that you need to be quarantined, and you need to report daily, okay, on the symptoms that you have. If you reported high risk symptoms, then the apps will get notification, and you will need to be sent to hospital or any other health facilities. But now they expanded My Sejahtera. So, for example, if I click on my health record, now I can enter my own height, my weight, okay, and then it will generate BMI. I can also put in my blood type, okay, vaccination, okay, medication summary. But at this moment, it's more like voluntarily. Okay, I believe not many Malaysians are using this effectively, even though this is like a very good app. Okay, just imagine if 70% of Malaysians really use this My Sejahtera app. They put in their height and weight, and in just a matter of seconds, we will get what is the average BMI of Malaysians. Okay? It can be as easy as that. Okay, so at the moment, the app is here, but in terms of usability, I believe it's not very high at the moment. So, but I really hope that this app, this app can be used to its maximum potential, so that we can use this data. It's really a big data. We can use the data that are being input by Malaysians for us to better track and also give intervention. Okay, next, someone who uses Google Fit, okay, to track their steps and calories. This is also one of the example of where big data can come from in the field of nutrition. It's not just Google Fit. There are a lot of other applications related to physical activity tracking. Okay. Next, when you post pictures or when I post pictures on Instagram and put certain hashtags, right? Like here, healthy eating, and you can see like, what people think about healthy eating. Okay, you can see here, hard-boiled eggs. Okay, healthy eating. So, as simple as hashtag is also a source of big data. Okay, uh, uh, so that we could see that what do people perceive about healthy eating. If someone is posting a picture of fast food and they put hashtag of healthy eating, we know something is wrong. We know that something needs to be intervened. Okay. Okay. Next, why is big data important for nutrition and health? Okay. Why? First is to understand population habit. Okay. But big data, yes, this is we're just talking about why big data is important for nutrition and health. But in our mind, we have to always remember we can only get the benefit of this if big data or if we could uh, use the applications. Okay, we can get data at the maximum level. Okay, if we get the maximum data, only that will be able to do some intervention. So one, if we have big data, okay, we can understand population habits. Okay, at the moment, if we want to understand population habits, we will do survey. Okay, we will have like healthcare officers going to certain places, trying to conduct survey or maybe some online survey. But then it might not reach everyone. Okay, when we are trying to do it manually. But big data, it will help us on what people eat, how active they are, or what are their health concerns. Okay, from the apps that they are using, from the online survey or something like that. So, for example, as simple as the Grab food application. Okay, if we really want to use the data, we could. Okay, if many young adults in Malaysia order fast food late at night using GrabFood, of course, GrabFood can track that, right? I mean, it is something that can possibly be analyzed. Okay, if we know that young adults order fast food late at night, it tells us about unhealthy snacking habit. So it can be used, that data can be used to plan a campaign, okay, as an intervention to this unhealthy habit. Next, big data can also beneficial in detecting health problems early. We can use data to find out if a nutrition problem is starting in a certain area or age group. Okay. I showed you earlier the iPosyandu app, right? So just imagine like if overall, all over Indonesia, every healthcare clinics use this app. Okay, so that very easily we can detect problem earlier on. Okay, if a village in Indonesia shows rising stunting rates among children in digital Posyandu records, health officers can act early with food aid and health check. Not saying that it's not happening right now. Or even now, I believe in Indonesia, Indonesia is actively trying to tackle stunting or malnutrition. It is happening, but just imagine if we could use big data. Okay, we can be very specific. We are treating specific people, and we can detect the problem much more earlier. Third one, big data is important in designing better health programs. Data help us plan programs for the right people. We are not wasting time or money. Now, yes, in Indonesia or even in Malaysia, we do plan a lot of programs. But are we doing it for the right people, or we just doing it generally in the hope of maybe our intervention or health program will somehow get get its way to those who need it? But if we use big data, we can be more specific in giving out the intervention. For example, if data shows that teenage girls lack calcium, so we know that teenage girls, not like everyone, so schools can better can offer high calcium milk. Even when we have big data, we may track like which school, okay, or organize bone health talk just for them, so we can be more specific. Okay, next, what are the benefits? Okay, this is the second last part. We will be talking about what are the benefits of using big data, and then we will cover what are the challenges. The first benefit of using big data, of course, better decision. Okay, better decision. Most of you have Netflix, right? So see like how Netflix can recommend you what to watch, right? Based on what you have watched previously, or based on what others who have watched this one movie previously. So you are more likely to also like the other movies. So that's how it might work for the field of nutrition too. Better decision. Okay, we get better decision from other data. Okay, from data from other people, so we can make better decision. We know who needs help the most, because most of the time the allocation, okay, for us to conduct certain intervention might not be that much. So we need to prioritize. So we can use big data to help us prioritize who need the help most. Not, as I said, we are not doing it generally in the hope that we might the intervention make its way to the targeted people. So for example, we can focus free breakfast program in school where most kids come without eating. Okay, the intervention of providing free breakfast is good. But when we need to prioritize, we can use big data to prioritize which school actually that we need to target first. Next, saves time and money. We don't waste resources. We act where it's really needed. Okay, if rural teens are physically inactive, we invest in sport program in villages, not just in cities. As I mentioned previously, it's not something that is not done. Okay, it's just that we used to do it manually. Okay, we go do survey. It will take time, but using big data, when we use big data, it can be done much more simpler, and it will save time. Next, benefits of using big data, of course, it will reach more people. We don't waste resources. It can reach more people. Sorry, this is a typo actually. We can reach more people when we use internet. Okay, a viral TikTok video promoting healthy Ramadan meals, for example, can reach more youth. Okay, then we are trying to do the traditional form. We use flyer or poster in a clinic. Okay, we can use social media. Okay, and when we are talking about social media, it will not just benefit people in one particular country. It will be across the globe too. Okay. Okay, now we're done with the benefits of big data. We are now come to the final part of my talk, talking about what are the challenges of big data. It seems very useful, but then, of course, there are challenges. First one is privacy concern. Dr. Zahara has also mentioned about this. We, when we are gathering data, we are actually we will have people's data. Okay, so when we're talking about privacy concern, people's personal health information must be protected. Okay, like iPosyandu app, for example, right? We still need to have in mind that these are personal data, and personal data should be protected, cannot be easily spread to just anyone. Okay, so if someone share their health info in an app, we must make sure that it is not leaked or misused. Okay, it's good, big data is good, but then it can also be misused. So that is one of the challenges. Next, internet and technology access. I guess we need to really acknowledge this. We know that the world has advanced, but then I'm talking this in this scenario of Malaysia too. Not everyone has smartphones or good internet, especially in rural area. Okay, even though we know that it's very important, big data is very useful, but this is the limitation. If someone, or if we still have um a lot of people who don't have smartphone or who don't have good internet connection, the data that we wish to get, you won't get it. Okay, so I guess we still need to acknowledge this limitation. Okay, if an app is used for food tracking, people in the rural areas, they might be left out. So again, like the iPosyandu app, wow, I mean the idea is very good, but then if the health clinic doesn't have good internet connection so that they are not able to enter the data, or like even mothers in that area, they don't even have a smartphone, so we would not be able to get the data for us to go to the next step for the data to be analyzed and for us to take action, okay, from the problems that might have arise from the data that we have analyzed. Okay, this one, need skilled workers. Okay, this is also one of the challenges. When we're talking about big data, well, we are nutritionists, dietitians, right? But we are not big data analysts, right? We have big data, but we need someone to analyze the data for us to use it. Okay? We need big data analysts to analyze the data for us and inform us. Okay, this is the problem so that we can take action. So we need more people trained to collect, clean, and analyze the data properly. Okay, so hospitals and health offices may need data analysts and nutritionists who can work with digital tools. So I guess this is in line with even what Dr. Anis was saying. We need to train students, or well, even us, as nutritionists and dietitians, we need to catch up with the skills, right? We need to catch up with the digital tools, so that we're not behind, and we can really use this for the usefulness of the nutrition intervention that we need to give. Okay, so in summary, big data helps us to see the full picture of a country's nutrition and health, just like a map shows all the roads. Okay, when we have big data, we can see the full picture. Okay, and it helps us to plan smarter programs. Just like big data in general, when we have big data, when we use big data correctly, we can build smart buildings, smart cities, smart factories, smart transport, smart consumer, even smart healthcare. Okay, so when we're talking specifically in the field of nutrition, big data will help us plan smarter program, help the right people, and improve public health if we use it responsibly. So in my view, I really think big data is amazing. Okay. If we can use it to its full potential, there are so many things that can be done. But of course, we need to also aware of the limitations that we're having, especially the access of internet connection. Okay. And also whether or not everyone has a smartphone so that the data can be used. Okay, I think that's all for my sharing today. Thank you very much. Back to you, Dr. Anis.
Thank you very much, Dr. Nurul Huda. Very insightful talk related to the big data and many use cases, and some also very appreciate when you are also sharing some Indonesian use cases or issues. For example, Posyandu, or also our program currently a free food program from the government. It is also very relevant to our situation. And we still have 5 minutes for discussion. I'm wondering whether students, I also expect students, any comment, question, or insight related to this talk? Hello. Dr. Nurul, usually Indonesian students are very shy.
Oh no, it's the same thing here in Malaysia too.
Any comment from students? You can speak in Bahasa. I think
Yes, no problem.
we are also sharing the same language.
Mhm.
Bisa pakai bahasa Indonesia kalau mau. Silahkan. Biasanya di kelas rame. Gak ada yang mau komen.
Terus di sini sepi gitu.
Di sini sepi, betul. Uh, I'm wondering you are still in front of your laptop or gak ada komen. Oke, kalau nggak ada mungkin from
Ya,
ya,
ada satu. Iya.
Nadifa. Ada satu. Nadifa, please, Nadifa.
Thank you for the kesempatan for asking a question. So previously there is pembicaraan terkait penggunaan big data dari sosmed. Nah, di sosmed itu kita umumnya lebih menunjukkan hal-hal yang baik. Dalam konteks ini mungkin menunjukkan pola makan yang lebih sehat begitu. Nah, apakah big data dari sosial media itu tetap masih relevan untuk digunakan ketika kita mau menilai apakah di satu populasi tertentu itu pola makannya atau terkait kesehatan itu baik begitu. Mungkin itu dari saya.
Okay.
Terima kasih.
Okay, I got a question.
Oke, terima kasih.
Yeah, I got a
Good
question. It's a good question. Betul, it's very true. Because when we post something on social media, we tend to only post something great, right? Of course, there are people who will be like very genuine. I don't really care what people think. I'll just post. Okay, but Nadifa, you brought up a very relevant thing about because I guess because earlier on I talk about how we can use hashtag, right, to see to really see if what's the pattern of eating. But you actually brought a very good question about maybe what they are posting is not what they is not their real habit. Okay. I guess if you're asking for more opinion, when we are talking about data analysis, we can only analyze the data that we get. Okay. It will be similar to what, when we ask someone to fill in an online survey, we will just trust that person, right, to report what they think. Okay, so if we are talking about straightforward way, we will just have to accept that it might be it might be that's the data that we have. But talking about that, maybe we will also realize that maybe analyzing data from hashtag might not be the most accurate way to to try to see what is the problem. Okay. I guess we just need to bear in mind that at least we know that we can use hashtags, photos, and everything to analyze, to see the trend. But then we also have to bear in mind that it might not be the best tool. Okay, I mean we cannot. Maybe it's not the best tool if we have some money allocated and we try to find what intervention can be done. Maybe it's not the best thing to rely on hashtags of youth. Okay, maybe Grab food app, that's maybe better because that is what they order, right? That is something that cannot be changed. Okay, but when something regarding to post, yes, we have to bear in mind that it might not really reflecting their day-to-day habit. But GrabFood, application like GrabFood, that will really show, okay, what is the trend of food consumption. I think that's all. But thank you very much, Nadifa, for your question.
Terima kasih Mbak Nadifa. It's a quite interesting question related to the bias from using data from
Yes.
social media. I think any data we need to consider, any researchers need to consider bias from the data we collected. And I think your question is also very relevant when we discuss big data. Unfortunately, we have our time is up. We have reached 10 past 9, and I think I will not to conclude this session, but we learned a lot about the opportunities and also the challenges of big data in a nutrition program. And thank you very much for Dr. Nurul Huda to share the experiences in Malaysia, especially related to My Sejahtera. Indonesia also learn, also we implement right now. Previously we have Peduli Lindungi, but then Peduli Lindungi was closed and then we continue with Satu Sehat. But fortunately in Malaysia you still have My Sejahtera without closing My
Yes,
Sejahtera, but
they
in
just
Indonesia
changed
Peduli Lindungi,
yes.
yeah. In Indonesia Peduli Lindungi closed and then Ministry of Health started from the beginning with the Satu Sehat.
Okay. Okay.
But we learn a lot, and hopefully we can. I agree with you. We need to learn together. We are coming from serumpun country. Hopefully, I also love nasi lemak very much. So I think we can share each other about this nutrition issue and also the technologies related to the nutrition. So because we have time's up, and I think I need to return back to Mbak Umi. Please, Mbak Umi. And sorry, applause to Dr. Nur Huda. Okay, back to Mbak Umi.
Thank you, Pak Anies. So thank you so much, Prof. Zahara Abdul Manaf and also Dr. Nurul Huda Razalli, a Master of Science RDN, for the valuable presentation, and also Bapak Anies Fuad for moderating this session. Bapak Ibu hadirin, before we close this program, there will be a photo session. This session will be guided by Pak Joko. Pak Joko, are you there?
Yes, yep.
So for the students and also all participants, please turn on your camera.
Adik-adik tampilkan semuanya biar kita foto bareng-bareng. Ayo, ini belum semuanya. Sekar, Puspa, Elsa, Nabila, Mosaya, Nela, Dita, Anindya. Ayo Puspa. Ayo tampilkan semuanya. Khairul Nisa ya. Anis, Nafisa, Puspa. Ayo. Panggil semuanya. Kaisa. Kita foto satu dulu. Ya. Ya, kita tampilkan. 1, 2, 3. Ya, kita acungkan jempol. Good. Ya, sama-sama. 1, 1, 2, 3. Good. Yeah. Thank you very much, Mbak Umi.
Thank you, Pak Joko. So, ladies and gentlemen, Bapak Ibu, and hadirin sekalian, we have finally come to the end of our program. On behalf of the Department of Nutrition and Health, the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, we thank you again, Prof. Zahara Abdul Manaf, and also Dr. Nurul Huda Razalli, and also we thank all of you, all of the participants for joining us today. See you in the next event. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, everyone.
You're welcome, Ibu.